Urology by Keyes. Chapter 1, Physical Examination. The physical examination of a patient cannot be too thorough. Errors in diagnosis are more often due to incomplete or careless physical examination than to any other fault. There are in the United States today innumerable victims of renal stone and tuberculosis being treated for an imaginary cystitis. Twice I have seen prostatectomy done for pyelonephritis. Once I have seen a testis removed for syphilis, and twice for subacute epididymitis, the diagnosis of tuberculosis having been erroneously made in each instance. Several patients suffering from arteriosclerotic nocturnal polyuria have been referred to me for prostatectomy. I know of a patient who submitted for months to vigorous local treatment for a mild gleat while he was dying of chronic nephritis. Such gross errors are due to careless physical examinations. Yet it would be hard to decide precisely what constitutes a complete and careful examination. It is certainly improper, for example, to cystoscope every patient with gonorrhea, yet it is eminently essential for some of them. The expert diagnostician shows his skill not only by basing his diagnosis on the salient points in the history and physical examination, but also, and above all, by recognizing the doubtful cases and exhausting for them every means of diagnosis at his command. The general rule of physical diagnosis should therefore be this: examine the patient to obtain a thorough knowledge, not only of the disease from which he suffers, but also of all possible complications and concomitant maladies that may have a bearing upon the prognosis or the treatment of this disease. Disease of the urinary organs is peculiarly prone to be complex. That a patient has prostatitis is no evidence that he has not pyelonephritis. That he has a stone in his bladder does not prove that he has not another in his ureter. That he has a tubercular prostate does not guarantee him against renal tuberculosis. These are but gross examples of the fact that we must constantly be on our guard against complex conditions in the genitourinary tract, of which the more obvious lesion may be the less important. The detail of our physical examination should cover several fields, viz. General physical examination, urinalysis, external examination of the genitourinary tract, internal examination.